Everything you ever wanted to know about pancreatitis. To understand pancreatitis, you first have to understand your pancreas. Your pancreas is located behind your stomach and kind of under your liver. It's closer to the back of your body than it is the front of the body. The pancreas provides enzymes and hormones for us. The enzymes that it makes are protease, which is used to break down protein, amylase, which is used to break down carbohydrates, and lipase, which is used to break down fats. If fats, carbs, and proteins can't be broken down, then they can't be absorbed in the small intestine and used by the body. If the pancreas is functioning normally, these enzymes only become activated once they enter the small intestine, where they'll be utilized. The pancreas also makes hormones that are used to control blood sugar. Two notable ones are insulin, which helps circulating blood sugar enter cells to be utilized, and glucagon, which signals to the liver to make and release blood sugar when the blood sugar is low. Trouble with the pancreas can mean trouble regulating blood sugar. The word itis literally translates to mean inflammation. So pancreatitis is inflammation of the pancreas. This can have many causes. The two primary causes are gallstones and alcohol abuse. But it can also be caused by trauma, medications that irritate the pancreas, infections, high triglycerides, tumors, genetics, autoimmune disease, or unknown causes. Risk factors for pancreatitis include obesity and smoking. It's seen in men and women, it's seen in various ages, and it's not specific to race. A gallstone can trigger pancreatitis by blocking the shared duct that the bile duct and the pancreatic duct share that lead to the small intestine. The inflammation from whatever triggered the pancreatitis activates the pancreas's digestive enzymes. When activated in the small intestine, these enzymes cause no harm. When activated in the pancreas, these enzymes begin to auto-digest the pancreas. In some cases, these enzymes can even leak into the abdominal cavity where they'll continue to break down surrounding tissue. The signs and symptoms of pancreatitis might include a stabbing abdominal pain. It's going to be located above the belly button but below the ribs. The pain may radiate to the back. Nausea and vomiting, fever, abdominal distension and swelling, and steatorrhea. We see steatorrhea in pancreatitis because the pancreatic enzymes that should be breaking down the fat are not able to. The fat is malabsorbed, and the excess fat and stool pass through the intestine quickly, resulting in oily, foul-smelling stool. This malabsorption of fat can also be caused by gallstones that block the bile from entering the small intestine and helping fat to break down. Pancreatitis must be diagnosed and treated at the hospital. The doctor may use a CT, MRI, or ultrasound to check for swelling or inflammation of the pancreas. Lab work indicating high levels of lipase or amylase may also indicate pancreatitis. The length of the hospital stay will depend on the severity of the pancreatitis. The patient will not be allowed to eat or drink at first for several days. The patient may be given IV nutrition into their veins or given a formula via tube into their lower small intestine. These will help provide nutrition for the patient while they are unable to eat or drink anything by mouth. The patient will be reintroduced to food and drink very slowly, first with clear liquids, and eventually they'll be moved to 6 small, low-fat meals each day. When your pancreas is inflamed, there should be no alcohol, no caffeine, and avoid high-fat foods. When pancreatitis is present, the diet should be very low in fat. This could include things like skim milk, water, juices, air-popped popcorn, whole grain bread, any fruit or vegetable prepared in a very small amount of olive or canola oil, or lean meats like poultry without the skin, fish, lean cuts of beef or pork. High-fat foods should be strictly avoided until the pancreatitis has passed. This means no whole milk, no biscuits, muffins, pastries, no fried foods or creamy sauces and dressings. Avoid regular full-fat cheeses. Avoid sausage or lunch meats unless they're reduced fat. No casseroles. When pancreatitis is present, you'll even want to avoid the healthy fats. These are foods like avocados, peanut butter, nut butters, and oil-based dressings. Avoiding fat is not a good strategy for long-term health. Our body needs fats. However, when the pancreas is inflamed, these fats, even the healthy ones, need to be limited. There is no need to try and take extra herbs, supplements, or vitamins, as we don't have research indicating that these are needed at this time or that they can help the condition. During a hospital stay, a nasogastric tube may be dropped into the stomach to suction excess stomach fluids that might otherwise be vomited up. PERT, or pancreatic enzyme replacement therapy, may be used to replace the body's enzymes with protease, amylase, and lipase from a pig. This decreases the incidence and severity of diarrhea and helps the body break down and absorb food. Not treating pancreatitis is not an option. If left untreated, there will be severe pain. There could also be destruction of the pancreas from the autodigestion that is occurring. There will be chronic nausea, vomiting, and diarrhea. Diabetes could also result from the destruction of the pancreatic tissue that secretes hormones that control blood sugar. If the pancreatitis is left untreated long enough, the patient may also experience malnutrition, systemic inflammation, meaning inflammation over the whole body, infection, and even death. Reoccurring incidences of acute pancreatitis can damage and scar the pancreas, decreasing its ability to do its job. This results in pancreatic insufficiency, or when the pancreas is no longer able to do its job of making and secreting digestive enzymes. Over several years of damage, chronic pancreatitis may develop. With chronic pancreatitis, the medical team will monitor for and treat chronic nausea, vomiting, and diarrhea, low appetite, malnutrition, and weight loss, pain, pancreatic insufficiency, and diabetes. As there is no cure for pancreatitis, the best strategies are prevention, early diagnosis, and treatment. In severe cases of pancreatitis, inflammation and/or infection can affect many different body systems. Some common things that we see are trouble breathing, a drop in blood pressure, and kidney malfunction that results in decreased urine output. If the pancreatitis becomes severe enough, some surgical options may include removal of gallstones if gallstones are present, drainage of any infection in the abdominal cavity, and removal of infected, dead, or necrotic pancreas tissue. Although many of the causes of pancreatitis are out of our control, the two main causes, gallstones and alcohol abuse, can be controlled and impacted by our lifestyle habits. So, what can you do to decrease your chance of getting pancreatitis? Maintain a healthy weight. Maintain healthy blood lipid levels, and drink alcohol responsibly or not at all. Eating right and exercising are lifestyle habits that not only decrease our risk of pancreatitis, but decrease the risk of many chronic diseases, things like cancer, obesity, diabetes, heart disease, stroke, high blood pressure. The list goes on. These lifestyle habits can also increase our health, happiness, and quality of life.